our Arizona COVID-19 response webinar for schools and childcare. We are so glad that you could join us. What we're going to go ahead and do is we're going to give introductions around the room so you know who is present, and we will go ahead and move forward from there with our presentation. So you have myself, Eugene LeVar. I'm the Bureau Chief for Epidemiology and Disease Control here at ADHS.
Susan Robinson, I'm the Vaccine Preventable Disease Manager.
Priscilla Laro, Vaccine Preventable Disease Epidemiologist.
And Rosa Lira, the Manager of the Preparedness Epidemiology Program.
Great. So we'll go ahead and get started today. I'll hand the floor over to Susan Robinson to get started with the presentation.
Great, thank you. Thank you all for joining again. We're going to talk a little bit about what the responses look like here, what's going on with COVID-19 around the world, and then a little bit more details about your setting in particular and how you all can sort of interact and participate with this response. So here's a quick overview. Like I said, we're going to go over what we are seeing both globally and here in Arizona. How can you all prepare? What can you all do? And then we'll have some time for questions. If you have a question, we're going to be using the chat box today. So send questions through the chat box, and at the end, we will do our best to address as many of these as possible. We also have our website up and running, which we've got some FAQs, which will be a great resource for you to come back to later. So we're going to start December 2019. During this time, China reported out that there were several cases of, or clusters of pneumonia with an unknown cause. These were originally linked to a seafood and wet animal wholesale market in Wuhan, China. And as time went on, there were increasing numbers of reports, but there was an increasing number that were not linked to this animal market. And so initially the thought was potentially what we were seeing was sort of an animal to human spread. And by the end of December, really, it was more of a potential of a human to human spread. January 2020, the identified cause of this pneumonia was found to be a new coronavirus or a novel coronavirus. By the end of January, there were over 9,000 cases globally. And airport screening in the United States was first initiated mid to end of January. We saw this initially happen at 3 airports, and this is now expanded to 11 of our airports. The first case of novel coronavirus was first seen in the United States on January 21st in Washington. And by January 26th, Arizona had confirmed our first case. February 2020, so this was originally called novel coronavirus. WHO officially renamed this as COVID-19. And by the end of February, there are over 50 countries with cases and over 80,000 cases identified globally. And in February, the United States has their first possible community spread of COVID-19. This is a map, and the WHO has been putting these out on a daily basis. And so these are cases across the entire globe. And as you can see, a large number of them are centering in on China, where this initially started, but has definitely expanded across the globe. And we've seen an increasing number of cases in an increasing number of countries. The WHO has done a really nice job, and like I said, they have this out on a daily basis to give you that global perspective of what is happening with COVID-19 across the globe. So we next want to talk a little bit about the virus. So COVID-19 is caused by novel coronavirus. Its official name is SARS-CoV-2. Coronaviruses are a large family of viruses, and there are several known coronaviruses that infect humans, and they usually cause mild respiratory disease, such as the common cold. So a lot of times during cold and flu season, we certainly have coronaviruses that are out circulating in our population. Coronaviruses can be found in animals, though, and some of these viruses do have the capability of transmitting between animals and humans. And so some examples of these would be MERS or SARS, if you've heard of those before. Those originally both started in animals and were transmitted then to humans to cause disease. So what do we know? So far, COVID-19 has a wide range of symptoms, from very mild to severe, and symptoms can include fever, cough, and difficulty breathing. A note that this may look very similar to many other viral respiratory illnesses, such as flu, and we certainly are still very much in the season with flu. There are limited reports in China for children, and luckily they describe mostly cold-like symptoms such as fever, runny nose, and cough. And it does suggest that children with COVID-19 may be more mild symptoms. And there seems to be, although there are some severe complications that have been noted, they seem to be fairly unlikely or uncommon. And so this is great news. For everyone though, generally we seem to see that COVID-19 illness is mild. A report out of China suggests that about 16% of cases have serious illness involved. And really the group that we have the most concern about are older adults and people with underlying health conditions like heart disease, lung disease, and diabetes, as we see that they're about twice as likely to develop these serious outcomes compared to younger or otherwise healthy individuals. The virus is thought to spread person to person, and so this happens via respiratory droplets. These droplets are produced when someone infected with the virus either coughs or sneezes, and at this time there's no evidence that children are more susceptible than adults. There's currently no available medication to treat COVID-19, and at this time there is no vaccine to prevent COVID-19. Both of these certainly globally are things that people are working on, and we hope to see soon. And then at this time, you can take everyday measures right now to help prevent COVID-19. So these are going to include things like you've heard your whole life, proper hand washing, covering coughs and sneezes, and staying home when you are sick. So I want to talk a little bit about this because at the beginning of this outbreak in December 2019, we had sort of one public health response. And as I'm sure you've seen through media and through communications that you've received from us and your other, your local public health, that we've really moved from this concept of containment of the virus at the source, and we're really moving more to this community mitigation. And so what does that mean? So in the early stages of an outbreak like COVID-19, public health is going to take measures to contain the disease, to stop it from spreading in our community. And so this is going to be identifying cases, testing individuals, and using measures like quarantine and isolation to help contain that virus. As we've seen an increase in cases and community spread within our own country here, public health measures need to shift with that change. And so we see that shift moving from containment to mitigation. And so when we move to this, we move away from things like finding each individual case and identifying each individual person and doing quarantine and isolation, and moving to concepts more like social distancing, which, you know, staying home when you're sick, not going out and doing travel, maybe an unnecessary travel. And so these are going to be sort of the things that you'll hear as we move forward with this response and how these will change. So what can you do as a school or a facility? What is your role in this response? So one of the biggest things for you all is to prepare and to check out your policies and procedures around emergency communication, sick leave and attendance policy, maintaining your school lunch programs, distance learning, and distance learning. So these are all things that you'll want to know as your facility or school, what your policies and procedures look like around these. Are you ready to implement them? And do you know how to inform all of those who will be working off of these policies and procedures what these look like? The next piece is identifying critical job functions and positions and plan for alternative coverage. We want to make sure that you all know what are the key pieces that keep your school or childcare running. and if individuals get sick, what that might look like for your school or a childcare. And then another option for this is additional staff training and cross-training to ensure coverage, so that we've got multiple people, we've identified those key functions and positions, and we've come up with additional people who maybe have been cross-trained and know how to do those functions as well. And the last one is to ensure that your sick leave policies are flexible and consistent with public health guidance. So we want to make sure that we've got sick leave policies in place that allow people to stay home when they're sick, so that they're not coming in and potentially spreading an illness within your childcare or your school. The next one, which I know is a big one for you all, is really around cleaning. And I know this is a really high importance for you all. So cleaning surfaces and objects that are touched frequently, so our high-touch surfaces like desks, doorknobs, railings, computers, keyboards, phones, toys for you that are in sort of the childcare setting. So really ensuring that we're following what our protocols and procedures are around cleaning, and ensuring that these high-touch surfaces are getting a good clean on a routine basis. We've got some information here about specific types of cleaners that you can use. So bleach and water solution is an option. I know some of you may not be able to use bleach in your facility. And so there's also a list that you'll have access to in all of our resources on our website. We've got links to this EPA-approved list of disinfectants. And really what you're looking for is these disinfectants that say that they're approved for killing bacteria and viruses. And we're going to always follow the directions on that product label. The next one that I know has been a high topic conversation is the travel. So schools may need to postpone or cancel trips that could expose students and staff to potential community spread of COVID-19. And schools and child care facility administrators are encouraged to consult with local public health when making such decisions. We know that these are not light decisions that you all are going to be making, and there's lots to be weighed when you are making these decisions. Using CDC's travel advisories is going to be a great place to start, and will allow you to really kind of understand what the global picture and where you may be traveling and the risk associated with that. But consulting your local public health when you're making these decisions as well is going to be really crucial. What can you all do to prepare your staff, parents, and students? So we know that there's lots of communication and information that these folks are looking for. And so there's going to be pretty basic measures, and you all have heard these time and time again, but we're going to ensure that we have supplies, tissues, and hand sanitizers as you are able for easy access so that people can utilize those. We want, again, people to stay home when they're sick. We want great education about everyday preventative measures, about washing those hands, soap and water for at least 20 seconds. I know that you all in that child care setting, that's a biggie that you're working on teaching all of your little ones that are with you, and it's such an important measure. Covering our coughs and sneezes with either a tissue or an elbow when possible. Flu vaccines, encouraging our staff and students to have their seasonal influenza vaccine. And then I'll note here that I'm not saying that your influenza vaccine is a preventative measure against COVID-19 specifically, but as we are still in the middle of flu season, the more steps we can take to avoid other illnesses like flu that could be, respiratory transmission. That's just one less thing that we have to worry about, and one more thing we can prevent. And the last one is thinking about posters or other places that you can post information about this, reminding people about proper hand washing and getting in there for 20 seconds, covering those coughs, staying home when they're sick, so that it is reminded to all of your staff, students, and parents on a daily basis as they walk through your halls about what would be recommended. I want to go into some, operations and policies that you all can consider. So the first is to work with your local Board of Education, Public Health Department, or licensing to establish an emergency operations plan. And this is, we really want to focus on an infectious disease when we're talking about an emergency operations plan. But there are some good models out there available to you. But again, having these up and running and knowing where they are and knowing what they say is really, really important. Developing an emergency communication plan for sharing information with staff and parents and students is going to be crucial. So we want to ensure that everyone knows how they're going to receive this communication. Maybe in your school or childcare, it's text, maybe it's email, maybe you have a school portal that you share information on, or maybe you just send things home in the backpack. But whatever way that you all choose to share this information, make sure everyone knows how it's going to be coming out and where it's coming from. Support flexible attendance and sick leave. We want to make sure that people are able to follow public health recommendations about social distancing, staying home when they're sick, and part of this is really going to be having these flexible policies around attendance and sick leave. Developing a system to alert public health of increases in absenteeism, and so be sure that you know who your local health department or local health, county health department. There are a couple ways we call them. So local health department, county health department, ensure that you know who that is and who you would contact in case you happen to see an increase in maybe respiratory illness or something else, so that you can alert them to what you are seeing in your schools. And then follow your school's facilities' normal protocols for management of sick children and staff. COVID-19 doesn't require anything extra or specific when it comes to sick children and staff. We know that you all deal with this on a daily basis and have these protocols and procedures in place. And so we ask that you just follow what you normally do whenever you have someone who may be sick or ill. Want to give you this additional resources. Again, this is absolutely going to be posted on the website, so you'll have all of these links available to you from the website. So there's a lot on here, so certainly not expecting you to absorb all of this, but I'll walk you through a couple key points here. So at the very top, we've got our Arizona coronavirus webpage, and right underneath it is CDC's coronavirus webpage. I think a really important piece in all of this is ensuring that we're getting proper information and we're sharing proper information. So these are going to be two places that you really can kind of come to and get a good source of truth about what's going on in the information that we've got and we can share. We've got some frequently asked questions for coronavirus, specifically around children, which might be helpful for you all. The next two are different response plans that you all might want to just look at and see if there's additional pieces that you might want to incorporate into your own emergency operations plan. So the first is the pandemic influenza response plan. And again, I know this isn't influenza, but it is a respiratory virus that we're talking about. So there's lots of good little tidbits throughout there that you might want to pull. And then this non-pharmaceutical intervention plan, that's really the things we're just talking about. So the hand washing, the social distancing, there's lots of great resources for you to check. There's some interim guidance that we've got here for your schools to create those plans, and then a couple different signs that you might consider posting. So those are all of our resources. And at the end of the day, really this response is a local and community response. And so, you know, we're here to give you some broad recommendations, things to consider, but really your local health department is going to be a great resource. Your county health department is going to be a great resource for you. So we've got a link here that gives you a link to all of their phone numbers so that you can contact them if you've got questions. And with that, we're going to move into our question period. So again, everyone is muted. Please type into the chat box, and we will do our best to work through these questions and answer them for you. Okay, so our first question is, how many confirmed cases are in Pima County? Do you know? And so Pima County, I believe since their release out yesterday, they currently have 1 case of COVID-19 at this time. Great, next question. Do you anticipate mandatory school closures in the near future? And I know that we didn't specifically talk about school closures, and I'll tell you that is because there is not a clear, simple, clean and dry answer to school closures. I think that what it really comes down to is a conversation about your community and a conversation with your local or county health department to help you make the decision about school closures. There isn't going to be an across-the-board Arizona guidance for this, unfortunately, and I think that, again, it's going to come down to those community-based responses and decision-making.
There's a question here about whether Tamiflu is helpful. So Tamiflu, or oseltamivir, is an antiviral medication used against influenza, and it has not been shown to be effective against the coronavirus. There are a couple of medications that are currently under clinical trials for use against this coronavirus.
Great. A question about how we test for COVID-19. And so this test is done sort of similar to if you've ever been tested for flu. It's a swab that you take either from your nose or from the back of your throat, and we do what's called a real-time PCR, which is sort of a laboratory test that gets sent either to a commercial lab. We've got a couple of those that seem to be up and running now, which is amazing, or our state public health lab.
There's a question about whether or not it is safe to fly. So currently, the recommendation from the CDC that we support is that is for social distancing for people who are ill or trying to protect themselves, and that would include limiting non-essential travel. So if you don't need to be traveling, if you don't need to be flying, the current recommendation is that you consider rescheduling or making alternative plans.
How many cases in Maricopa County? There are 3 cases confirmed in Maricopa right now.
There's a question about whether or not there's a protocol or recommendations for students who are returning from cruise ships. So the current recommendation is really to be screening and watching your student population for signs of illness. And if the student has any signs of illness, that they be excluded from school. Again, that can include fever and cough predominantly. Considering some of those high-risk exposures, so either to those geographic areas that are having high incidence of COVID-19 or those congregate settings such as cruise ships that might increase a student's risk may just play into how urgently you are screening those students. Question about making a final decision to close a school, and that's a decision made between the governing body of the school and local county health.
I'll tell you that we've had cases in Maricopa County, Pima County, and Pinal County as of today.
There's a question about what kinds of cleaning solutions to be used effective against the coronavirus. So there is a list linked on our website to a number of EPA-approved cleaners. It's a long list, and we expect that most of the cleaners that people are already using are probably included in that list. You can also use a bleach and water solution, and we also have links on our website to instructions for preparing that solution.
There's a question, how many tests can be processed daily in Arizona? If we're talking specifically about the Arizona State Public Health Lab, they have the potential to run approximately 450 tests within a day.
We've got a question about now that this has been declared a pandemic, will its defined guidance change? And I think that, as I talked about a little bit earlier, I don't know that calling it necessarily a pandemic made that shift, but it's really how we see the virus and its movement through our communities, and that's really the big reason you're seeing those shifts from containment to more of a mitigation direction.
There's a question here on whether schools should require a doctor's note for staff members who are returning from geographic areas with high incidence of COVID-19. Current recommendations for travelers returning are for self-isolation and watching for those symptoms to appear. There's no strict guidance to restrict employees from work after returning from these areas. Again, as we move from a containment to a mitigation approach, it's just not reasonable to expect that we're going to be able to institute quarantine or isolation. And as we have the infection in our community, you're just as likely to be exposed to it in the community as you are from someone returning from one of those areas.
There's a question, any suggestions on where to get cleaning supplies? We can't get our hands on them in the stores. I think as Nick mentioned earlier, that there is a full list of approved cleaners available from the EPA, which is titled List N. We would definitely take a look at what supplies you're trying to get and maybe look at some possible alternatives and then trying to work with other vendors to see if there's a possibility to get some of those items.
There's a question of how do we know if a child has symptoms and sent home? Parents took them to the doctor's office and they were tested for the virus. So we'll tell you here at Public Health, this is very similar to other infectious diseases that we work with you all on. If there's a concern for your school specifically, if there's a reason, you know, if there maybe was an exposure or something like that, we're going to let you know. If there was not, it's unlikely that we're going to let you know. And again, our reason for communication is really based on needing an action to occur. So that's sort of how that will work, and very similar to other infectious diseases.
There's a question on whether it's necessary to have a nurse come in to provide cleaning, and I would say no. Whoever does your standard cleaning at your school should be more than capable of cleaning up in this setting. There's a question about once you are diagnosed with coronavirus, how long does it stay in the system? That's a good question. Because this is a new virus, we don't have all that information yet. We know from testing patients that even after they are no longer symptomatic, you may be able to detect that they had been sick with the virus. But our guidance allows for return out of isolation and return to school either 7 days after diagnosis or 72 hours after the resolution of fever, whichever is longer. So that's the guidance that we're going to be giving to clinicians, and that should stand for schools as well in terms of returning to school after being ill.
All right, we've got a question about the county-specific information, and so you are correct. At this particular moment, we do not have it broken out by county, and that is something that we're going to be hopefully doing soon. So stay tuned and keep checking back in with our website.
There's another question here around school closure and kind of what is the criteria for closing school, whether it's one positive patient or something else. And again, that's a discussion that you can have with your leadership for your school or school district in consultation with the local health department, and they will be able to help guide you with those decisions. There's another question as to whether or not a school nurse would necessarily send a student home for severe cough but no fever. Again, I would leave that decision with the school nurse and kind of your internal policies. I would treat this very similarly to how you treat the control of influenza in your school. And if that's standard practice for seasonal influenza control, then I would stick with that. There's a question here about how this novel coronavirus compares to seasonal influenza and whether how similar those two are. So the difference between seasonal influenza and this virus, important differences are that we can vaccinate against influenza and that we can treat influenza. We also know that influenza affects children and the elderly more severely than otherwise healthy adults. So that's a consideration when comparing these, whereas the new, this novel coronavirus or COVID-19 appears to not affect children as severely as the elderly. So again, it's, I think, too early to know exactly how this is going to play out in our own communities, and we're just watching it closely.
All right, with students and staff returning from spring break, are there any additional preventative measures needed? So I think sort of what Nick just said, I mean, we want to be monitoring for those symptoms, and you want to ensure that you've got a system in place to be able to do that. But I think really, other than that, that is the most important thing. And I think communicating with your students and staff and parents that this is what we should be looking for, and having them be sort of an active participant with this process with you of taking proper measures.
The question about whether field trips and after-school activities are likely to be canceled. Again, that decision, like school closures, is a decision to be made within your school and school district. I would expect that we see cancellation of field trips and after-school activities before we would see school closures. It's just in kind of that sequence. But again, that is a decision to make as you see how this illness may be affecting your school and your community.
The question about whether it's safe to go to crowded places during spring break or should we avoid it? I think the general across the board is if you are at higher risk, especially really considering travel and whether it's needed is going to be pretty important. So I think that's just something for you as a person to sort of consider your risk level and whether or not it's needed.
There's a question here, what commercial solution has proven to be effective? And I'm taking that as to, in regards to cleaners. Once again, we would recommend if you're looking for those that are specifically for COVID-19, there is an EPA list N as in Nancy that is available that lists out those cleaners that have been proven to be effective against that particular disease and the virus responsible for that disease. We have the link on our website at azdhs.gov/coronavirus where you can find this information under the school tab. Or if you simply want to go to Google and you want to enter EPA list N as in Nancy, you'll be able to see that list.
There's a question about whether it's recommended to send all children home with cough or any sickness. So again, I would refer to your policies that are already in place as to how your school deals with sick children, whether or not that's isolating them, bringing them to the nurse's office for a period of time, or sending them home as they are, if their custodians are able to take them home. So again, I would refer you to the standard policies that your school already has in place.
A question about COVID-19, is this seasonal like the flu? It's a great question, and we'll certainly learn more as we continue on. This is novel disease in humans right now, so this is really the first time we're all seeing it, so we'll just have to hold on and wait to see what that looks like.
There's a question here about pregnant women and whether or not, whether there's anything, whether they are more susceptible. So again, we are early in the stages of this infection and assessing that. We consider pregnant women to be at higher risk than otherwise healthy adults. But again, we don't know how much higher risk that is. And then reports are currently showing that it is very unlikely that the viral infection be transmitted to the baby from a pregnant mom who's infected.
What age population does the virus seem to have large numbers with, or I'm going to say most highly affected? So we are certainly seeing our older populations being more highly affected by COVID-19. 60 is a number that's sort of thrown out, but I think as a person gets older, they seem to be more and more potentially affected by the virus.
There's a question about incubation period and quarantine. So the incubation period for this virus is somewhere between 2 and 14 days. That is where the quarantine period for 14 days has come from. Again, as we spread from a containment, or as we change from a containment to a mitigation phase, using quarantine as an option is you're going to see that used less commonly. Again, we are going to use social distancing as our way of keeping people safe and healthy, and using the 7 days after diagnosis or 72 hours after fever-free as a way to recommend that positive patients no longer be isolated. There's a question about taking the temperature of a child as they enter a child care facility as a screening process, and that is something that you may want to consider. But again, that's not a recommendation that we are currently making, but something that you may consider on a facility-by-facility basis.
There's a great question. If we send a child or teacher home ill, or they stay home, should we require them to get tested? So testing is really going to end up being on a provider, sort of question. And so, no, we would not require an individual to get tested prior to coming back. And Nick kind of highlighted this a little bit, but 72 hours after symptoms resolve, we would be fine to let people back into school.
There's a question about if you suspect that a student or child has been exposed to someone who has tested positive, should they be excluded from school? So currently we are only recommending exclusion for symptomatic people. And that's the same thing that we're doing in healthcare facilities. So I would say that would apply to schools as well. There's a question about comparing symptom difference between allergies and coronavirus. So coronavirus usually causes a fever and allergies do not. Other than that, the symptoms can be very similar. Coronavirus also causes fatigue and muscle achiness, very similar to the flu. And that should not be the case with allergies. There's a question about how to contact local health departments in case you have questions about school closures or some of these other issues that we have referred to the local health department. And there's a link through the Arizona Department of Health Services website to the contact information for your local health department. There's a question about whether or not it would be advised not to use water fountains during the season. So again, I would go back to your standard procedures of what you do during flu season. I would consider those to be high contact surfaces. So again, really focus on those places in your facilities where people are touching and using frequently, and kind of target those with frequent washing.
So there's a question about hosting school events and whether there is any guidance around that. I think a lot of what we just talked about with proper hand washing, having good access to either hand sanitizer or hand washing stations, these are things that are definitely going to be useful during these sorts of events. And then I think just calling it out and encouraging people to say, hey, we want to be ensuring that we're washing our hands and covering our coughs and sneezes and doing those sorts of things. I think if you've got more questions about whether how it should work or how it should look, your local public health or county health is potentially a great resource for that.
There's a question just to clarify those criteria for removal from isolation after testing positive for COVID-19. Our current recommendations are going to be 7 days after the positive test or 72 hours after fever stops, whichever of those two is longer. And the question is comparing that to a 24-hour fever-free restriction. So the 72-hour comes from our recommendations for seasonal influenza. So again, that's the guidance out of our department, and it's up to individual schools to come up with their plans that they will enforce at school. a question about if a parent chooses to keep their child at home for an extended period of time out of social distancing, is there leniency on their attendance record? So we certainly have been talking to businesses and schools about attendance policies and how to address those in the setting of this outbreak. So again, if you are considering doing that with your children, or you're talking to parents who are considering that, I would advise that they talk to the leadership at the school to talk about how they're going to deal with a change in that attendance policy.
There's a question here, should we accept packages from China? And I think it's a good idea to do normal hygiene practices when accepting any packages or any items that you're touching. You know, there isn't an exclusion from those particular packages, but practice good hygiene when you're touching items. Be sure to wash your hands after working with those packages. Try not to touch your face and areas that may be an introduction or a transmission point for infection. And hand hygiene comes into play when doing that, and following those guidances appropriately.
We talk a lot about the role that being in close contact plays in the transmission of this virus. The CDC defines close contact as within 6 feet. And so in terms of trying to maintain that distance in order to reduce your risk, 6 feet is the distance that is recommended. There's a good question about contagious period versus incubation period. And again, I will say that there's a lot about this infection that we don't know, and that's why we use incubation periods of 2 to 14 days. The contagious period is also unknown, whether or not a patient is contagious prior to developing symptoms, and then how long are they contagious after they get better. That is unknown. So we are currently recommending that as long as a patient has symptoms, they are most contagious, and that's why a lot of our recommendations are related to that symptomatic period.
There's a question here about can you be infected with the virus without fever? And yes, so I think that we have seen really a spectrum of disease presentation. I think, you know, a majority of people are presenting with fever and some sort of respiratory symptoms, so cough or shortness of breath. But it is certainly possible, and I think, you know, in the literature and in other countries, in our country, we've seen lots of variation of what this may look like.
There's a question about how long does this coronavirus live outside of the body? Again, that's one of those questions that we would love to have answered. We know based on other coronaviruses that they can last from anywhere between hours to days. The current thought is that this virus is lasting probably a couple of hours on surfaces. So that may help kind of dictate how frequently you are cleaning. But again, at this point in time, our recommendations for disinfection and cleaning is to follow routine practices and then really address those areas that are high touch or frequently touched surfaces.
Great. Well, it looks like we've gotten to the end of our Q&A session, and all of our questions have been answered. Once again, we would like to thank you for joining our COVID-19 webinar. We hope you found some useful information. And as Susan and others have mentioned, we do have our website, azdhs.gov/coronavirus, where you can go to find additional information. We hope everybody has a wonderful day, and thank you.